Kusimama as they usher the guests to sit. Asanteni sana. Ladies and gentlemen, I would like all of us to be upstanding for the national anthem. We will have the national anthem ya Kenya and the East Africa anthem, one stanza each. Kisha baada ya hapo tutaweza kuendelea na program. Kindly, kama una kofia ambayo si rasmi, ningeomba uweze kuivua kwa heshima ya wimbo wa taifa. Asante. Thank you. I request that we all be seated. Karibuni sana, the Director General, International Atomic Energy Agency, His Excellency Rafael Mariano Grossi, the Cabinet Secretary for Health, Honorable Eden Duale, His Excellency Abdulswamad Sharif Nasser, the Governor of Mombasa County, the PS in the State Department for Science, Research and Innovation, Professor Shaukat Abdurazak, the PS in the State Department for Medical Services, Dr. Auma Oluga, Dr. Saumu, the CEO, Dr. Meli Elias, CEO, National Cancer Institute of Kenya, all the county executive committee members from the county of Mombasa, all the county chief officers, the members of the county assembly, the rest of the team from the National Cancer Institute of Kenya, the community health promoters, and everyone who's here. Karibuni sana to the launch of the LINAC machine for radiation treatment of cancer patients that is happening today at this venue. We are pleased to have you and pleased to host you. Thank you very much. Karibu sana Bwana CS. Asante sana for being a friend of the county of Mombasa. Without wasting so much time, Your Excellency, I'd like to just request the team to entertain us for 2 minutes. Karibu sana Gonda, dakika mbili zenu tuweze kupata entertainment. Asante. Wapi makofi ya Gonda dancer? Wapi makofi ya Waziri Duale? Wapi makofi ya Director General? Na wapi makofi ya mstahiki gavana? Asante sana Gonda dancers. Asante sana. Thank you, thank you, thank you. Thank you very much, Gonda dancers. Our chief guest, that is a test of the coastal music. I hope you enjoyed it, although I didn't see you do a real jig, but you'll get the hang of it with time. Thank you very much for joining us. I'd like at this point to call the County Executive Committee member who's representing the County Executive Committee member for Health, who's away, Waziri Mohamed Osman, to give us the opening remarks. And after that, invite Dr. Meli Elias, the CEO of the National Cancer Institute of Kenya, to be able to proceed from there. Thank you very much. You'll get the microphone just now. Don't worry. There it is. Thank you.
Good afternoon, Your Excellency Absalom Shafik Nasir, the DG, all protocols observed. Mine is pleasure to invite all you for this occasion. It's a great honor and humility to stand before you here today as acting CCM for Health during this historic occasion, the official opening of this cancer center. Today is not merely launch of a building. It is the opening, hope, dignity, and a healing of a renewed commitment to the people we serve. This center represents collective determination to confront one of the greatest health challenges affecting families across our county and our nation. Cancer has burdened many households, emotionally, physically, and financially. Too many families have traveled long distance seeking treatment, endured expensive care, or lost loved ones due to late diagnosis and limited access to specialist service. This center is therefore a direct response to this reality. As a county government of Mombasa, under the leadership of His Excellency the Governor, we remain committed to strengthening healthcare system through accessible, affordable, and quality medical services. The establishment of this cancer center marks a major milestone in our journey towards universal healthcare coverage and the people-centered healthcare. We strongly believe that early detection saves lives. Through this center, we aim to shift from directive healthcare to preventive and proactive healthcare. We must continue educating our communities on regular screening, health lifestyle, and timely medical checkups. I wish to seriously appreciate all stakeholders who made this project possible. Our healthcare workers, county leadership, development partners, donors, technical teams, every individual who contributed toward this noble initiative. Your support demonstrates what we can achieve when institutions and community work together for a common purpose. To our healthcare professionals, today we entrust you with more than equipment and infrastructure. We entrust you with the lives, hopes, and confidence of our people. Let this center be defined by professionalism, compassion, integrity, excellence in service delivery. To cancer patients and survivors present here today, we want you to know that you are not alone. Your courage continues to inspire us to invest more in healthcare system that protect human and dignity and save lives. As we officially open this center, it stands as a beacon of hope for present and future generation. May it be a symbol of resilience, innovation, compassion on healthcare in our country. With those few remarks, I invite Dr. Meli. Thank you, Dr.
Well, our chief guest today, the Director General, International Atomic Energy Agency, our Cabinet Secretary, Health, Honorable Haden Duale, our Governor, Mombasa County, our Principal Secretary, Medical Services, and Principal Secretary, Research, Science and Innovation, fellow colleagues, all distinguished guests, good afternoon. We do welcome you here today for this auspicious occasion. And thank you, DG, for finding time to visit with us. At the National Cancer Institute, under the leadership of our Cabinet Secretary, we have a robust cancer policy in this country that we are implementing to make sure every Kenyan can access quality healthcare in general, and in this case of relevance, the best cancer care in this country across the entire continuum of care. Our chief guest and our CS, it is your meeting. Mine is very brief. We have the National Cancer Control Strategy that we are rolling out across the country, and under Pillar 3 of relevance is comprehensive cancer curative services, and the radiotherapy program we are launching today falls squarely under that pillar. Access to our patients on radiotherapy services has increased twofold, and we are truly appreciative of partnerships for impact. And this is one between the Kenyan government and the IAEA. Without further ado, our chief guest and our cabinet secretary, all guests, I am going to invite my colleagues who are the heads of the Mombasa Regional Cancer Treatment Center and Nakuru Regional Cancer Treatment Center. As a way of scaling up our cancer treatment services, we currently have 6 public comprehensive cancer treatment centers across the country, 3 at the national level and 3 at the regional county levels. And this has made sure our patients do not travel far from the rural Kenya to get services in urban areas. This is the services under the leadership of our cabinet secretary that this country is receiving currently, and we are truly appreciative. Our CS has been very, very supportive of cancer care in this country than any other we've ever had, and we really want, can we clap for our cabinet secretary? He has been here in Mombasa at this center 5 times. That shows he truly cares about cancer care in this country. Thank you for the support, CS. We are truly appreciative. And we know with you, we are going to end this menace in this country. Now, allow me to invite Dr. Fatma. And also today, as we launch the Mombasa radiotherapy program, we are virtually launching the Nakuru radiotherapy program, of which our DG IAEA supported us. And I cannot step down without appreciating the work of our PSS. From Ministry of Health, Dr. Uma Oluga has been instrumental, and Professor Shaukat, who you worked with at IAEA, who squarely knows about this project, and I know they'll have their time to speak. Dr. Fatma, if you may join me up. Dr. Fatma is the director of the Mombasa Regional Cancer Treatment Center, a very able lady who has made sure our patients here are getting none but the best care. Welcome, Dr. A short brief about the Regional Cancer Center.
Yes, good afternoon, everyone. Our honorable chief guest, the cabinet secretary, your excellencies, distinguished guests, ladies and gentlemen. Welcome to Mombasa Regional Cancer Center. For some, this is our first visit. I hope we have managed to impress you and would want to visit more and more. So we see that over the years, the burden of cancer has continued to rise. Many patients had faced challenges and had to be referred outside of Mombasa. So if we are to speak of 7 years ago, most of the patients could not get radiotherapy services. So it would be a death sentence, go back home rather than go to Nairobi. Then the Ministry of Health in 2022, we established the Mombasa Regional Cancer Center, which was established to improve access to quality cancer care. So what does that mean? A mother can receive treatment while she's still at home. A patient can still continue with his livelihood while he's getting his treatment at his hometown. So currently, we offer oncology consultation services, chemotherapy, radiotherapy, survivorship, awareness, early detection, training, and patient support services. So since 2022, we have treated over 1,800 patients. And with the second machine that has been added, we have doubled the number from 60 patients a day to 120 patients a day. What has this done for us? We have decreased the waiting time. We have improved the outcome of our cancer patients, the cure rates, and the turnaround time has improved. So we remain grateful to the national government. Thank you very much. We will continue requesting and asking for what we need so we can improve our services. The county leadership, IAEA, thank you very much once again. So as we commission today's lineup, we also, as a team, commit to quality, safety, and compassionate care. Technology is not enough. We need our compassion in the system. So we will say it is not just a facility, it is a lifeline for ourselves and our patients. Thank you very much.
Our chief guest, our CS, our PSS, this is the only center that does not have a waiting time for patients. When patients get here within recommended time, maximum 10 days, they've begun their treatment, and we really appreciate that support. Allow me now to invite the director of Nakuru Regional Cancer Center to give us a short brief. Nakuru Regional Cancer Center is at the heart, at the center of this country, and serve counties from the south, from the north, from the east, and from the west. Dr. Wanda is one of very aggressive doctors at the Nakuru Cancer Center who has a huge team that they've done the best in that region. You're welcome, Dr. Wanda.
Good afternoon. So the chief guest, and kindly allow me to stand on existing protocols as I speak. I'm very pleased to stand before you here today to represent Nakuru County. I am privileged to have worked in Nakuru County since the year 2015, and the Oncology Center began in the year 2018. We were able to start off with chemotherapy services. I remember the first month we only had 10 patients that came for chemotherapy. The numbers really swelled, and by the time we were in 2019, we were seeing around 30 patients for chemotherapy daily. The challenge that I faced as a doctor at that point was seeing patients who needed radiotherapy and them not being able to go for services. Many patients had never visited Nairobi, so you tell them they need to either go to Nairobi, Eldoret, or private facilities. That was really disheartening. We lost many patients who did not travel. They died. We would watch them come in stage 1, stage 2, not go for services and eventually die. It was heartbreaking. So we were able to compile data, and we are very pleased that the national government was able to consider Nakuru as one of the centers to benefit from radiotherapy. We got our first machine, but the catchment area is very large. We serve patients up to 18 counties within our region. So we have patients coming from Narok, we have patients coming from Nyandarua, we have patients coming a huge catchment area. When we did our data last, we were serving about 17 counties. That's a very large number. Per day, we are able to offer at least 80 radiotherapy patients being treated daily. We are also able to give brachytherapy. Our challenge has been the applicators. We only have one for advanced cancer of the cervix, and that has been a challenge because when you do one procedure, you have to remove it, clean it, sterilize it, and then do the next procedure, and that has been a challenge, and that takes a lot of time. And when we look at the national statistics, then cancer of the cervix is really up on the charts. And unfortunately, because of our low vaccination rates, you find most patients present at stage 3 or 4, which needs the applicators that we don't really have. However, we are really grateful for the second machine that came because it has enabled us treat more patients. It has enabled us have a shorter waiting time. Previously, when we'd send them to Nairobi, the waiting time was about 3 to 4 months. Currently, we've been able to reduce that waiting time to about 3 weeks now. Remember, we are surging a huge catchment area, and referrals are quite significant. And our chemotherapy unit is also really growing. We appreciate the efforts of the Ministry of Health, NCI, and also IAEA. The support that you've given the training program at the University of Nairobi has ensured that Nakuru has benefited. I am a beneficiary of the training that has been held in Nakuru, in Nairobi, University of Nairobi. I am a pioneer of that class, and because of the sponsorships that you've been able to give, we've trained many more. We have 2 more who have also in training. One has joined us recently and another one is still in training. Definitely with 2 machines, the workload is something we need to look into. The trainings, the support that you're giving in terms of scholarship is really, really helping the patients and ensuring they get the care they need at the right time, and it's actually life-saving. What are we looking to see in the future? We want to get to a place where we are doing more in terms of the treatment and seeing more early disease. When we look at our statistics, when we started out, 70% of the patients that would come to our center were stage 4. Right now, the percentage has gone down to almost 40%. That is a really remarkable change, and that's because of the services we can offer in-house. So we are really grateful. We are happy to be here. We are hoping you will come someday in Nakuru and see the machine that you gave us. It will really be a privilege, and thank you very much. Have a lovely afternoon.
Thank you very much, DG. These centers provide care, training, and research, and we cannot separate the 3. Allow me at this point to recognize my fellow CEOs who are involved in IAEA-related projects. Cancer care is multi-sectoral under the leadership of Ministry of Health, but we have support from many other sectors within the country. My colleagues, fellow CEOs, if you may rise up just for our guests. So we have the Director General of Kenya Nuclear Regulatory Authority, DG James Keter. They are making sure we have safe delivery of radiation and all the other nuclear application that we are using peacefully. And we have Mr. Justus, who is our National Liaison Officer for all IAEA projects in the country across all the sectors. Without coordination from his office, we would not be a united team. He is from the State Department of Energy. We truly appreciate, and of course our able CEO from the Coast General Hospital, who has done very well to put this together. Allow me to also appreciate your PMO, DG, Dr. Amal. We have worked very closely to make sure we have delivered this project. At this point in time, our chief guests, our CS, our governor, our PSS, allow me to invite the chairperson, National Cancer Institute, to just make few remarks and invite the PS Medical Services, and the PS will continue with the program. Thank you.
Our chief guest, the DG, the Cabinet Secretary for Ministry of Health, the PSs present, all protocols observed. I'm Dr. Timothy Olweny, I'm the chairperson of the National Cancer Institute. I'm aware we are constrained for time, but I'd still like to express our sincere appreciation to IAEA for the partnership that we've had. And the reason I say that is because National Cancer Institute is one of those institutions that is mandated to strengthen oncology infrastructure in our country. And definitely the partnership you provided and the infrastructure you assisted, you can see from the testimony of those who have spoken before, has gone a long way in terms of improving cancer care in this country. One of the other things, of course, that we have to do in terms of delivering care in our country is that I keep saying all these things that we do have to be focused on making sure that our patients, the experience and the journey is better. Otherwise, we labor in vain. So at the end of the day, I'd just like to express appreciation. I'd like to specifically also thank our Cabinet Secretary and our PS for the leadership they've provided in terms of being able to steer cancer care, and we have seen a huge difference in this country. Thank you very much.
To our chief guest, Mr. Raphael, and our Cabinet Secretary, all protocols observed. Mine is very simple, sir. It's just to invite my colleague, Professor Shaukat, who is PS Science, Innovation and Technology, just to say one or two. He worked with you and I'm sure you are known to each other, so, and then we can proceed with the program.
Thank you very much, PS Oluga. Our chief guest today, DG Grossi, our Cabinet Secretary, Honorable Duale, our host here, His Excellency Abdul Samad Sharif Nasser, our Governor, all protocol observed. DG, normally when I come home, I don't speak English. But for your benefit, allow me today to break the protocol, and I want to ask my colleagues to bear with me. Nitazungumza kwa lugha ya Kiingereza kwa sababu ya wageni, lakini mimi huwa nikiwa nyumbani nazungumza lugha ya Kiswahili. DG, this is my home. Let me tell the audience here that when you called me in your office, February 2022, and you told me one thing, Shaukat, I have a vision. The vision is Rays of Hope. And you're asking me, help me so that we can realize this big vision that is unacceptable, that more than 75% of the population in Africa have no access to diagnosis and treatment of cancer. There are countries over 100 million people, DG, and you visited those countries, and you said it's unacceptable that if the global north could be able to have facilities and treat people, why not the global south? And after the discussion, Kenya was one of the countries. I want to say here that again, through your leadership, the visionary leadership, you said you want Kenya as well to be part of this Rays of Hope. And when I came to you and I told you that within Kenya, we also have counties like Mombasa, where you have to travel at least 500 kilometers, you said, bingo, let's go ahead. And through the support of US under your leadership, we were able to procure these Linux. Mine is really to thank you and welcome you home. This is your home. And DG, please, next time, give us more time so that you can sample the hospitality of this region. Asante sana in English is thank you very much. God bless. And we wish you all the very best. Asante. Thank you very much.
Thank you, Professor. And as I just invite the Governor, Chief Guest, and CS, just to mention that you already heard about the 6 public cancer centers, and we are in the process of completing 2 more. One in Jaramogi Oginga Odinga in Kisumu, which is going to be completed in August of this year, and another one through the leadership of the CS in Kisii that we are also completing. So we are going to have within this year 8 comprehensive cancer centers in the public sector. And we therefore would like to indulge you. I'm sure the CS is going to talk about it in a number of other areas, including expanding equipment and also trainings. So with those very many remarks, it's now my pleasure to welcome the host governor, His Excellency Abdul Samad, to speak to us. And then I will welcome the next guest. Thank you.
Good. Am I meant to hold both? Okay. Can I leave one? Yeah. All right, thank you very much. Am I audible? Mwanisikia sio? To our chief guest, I'll never be able to work in silos. That means I have a team of people who I work with on the other arm of government, and that is the county assembly. Maybe through their own protocols, one of them can be able to just stand up and introduce, because I'm seeing a full house. That means if we were to pass legislation right now, right here, we have no issues whatsoever. Maybe one of you, in terms of seniority, can just be able to, we have a team, and he can be able to just introduce the others who are here in the interest of time.
Thank you, Your Excellency, our chief guest, CS, Waziri Duale, all protocol observed. Before us are members of County Assembly. From my right, we are having Mheshimiwa Mria Juma Boy, MCM Jambere, she's also a lawyer. We are having Honorable Mwinyi, MCM Tongwe, Vice Chair Labour Committee. Mheshimiwa Shuhudia Abdalla, nominated MCA, Vice Chair Implementation. Mheshimiwa Ibrahim Oyugi, Chair Education Committee. Mheshimiwa Patrick Mbele, MCA Bamburi, Chair Blue Economy and Agriculture. Mheshimiwa Franklin Makanga, also a lawyer, MCA Chaani Ward. Mheshimiwa Mama Milka, nominated MCA, Vice Chair Education. Mheshimiwa Leila, MCA Kipevu, Chair Water and Climate Change. Mheshimiwa Mwaka, nominated Vice Chair Transport Committee. Mheshimiwa Florence Kachumbo, Board Member, County Assembly of Mombasa. Mheshimiwa Juma Saif Manuari, MCA Beaufort and Chair Justice Committee. And the host Chair, Mheshimiwa Bernard Ogutu, Chair Committee on Health. Thank you, Excellency. And my name is Athman Mwamwiri, the leader of majority and also a member of County Assembly representing Likoni Ward. Welcome.
We have a very supportive assembly, so, and nothing that we do can be able to be done without the support of your colleagues. And I want to state on the onset, first and foremost, the DG, I want to welcome you to Mombasa. Together with, I can see the sweat that you're having, and the fans are trying to do a good job. Ideally, on a day like today, we would probably be here with an Arsenal t-shirt. But then my team reminded me, Waziri Duale is a Man U fan. He would have taken it very personally. So here we are with long sleeve shirts and ties and suits. But needless to say, I also want to recognize and appreciate P.S. Oluga. P.S. Oluga, before I became the governor of Mombasa, I would visit him. I have a history with all the three who are here. The history that I have with the C.S. Duale, before I became the governor of Mombasa, I would visit his office. He had a very, very beautiful coffee making machine. And he was my leader of majority when I was in parliament, and I would visit his office very frequently, and he would advise me on a number of things. Oluga, I visited him before I became governor, and the discussions we actually had was that one day I will be the governor of Mombasa. What are we going to be doing about health? And here we are, true to the word today, that we are actually here and talking about matters of health. Professor Shaukat as well, the conversations on what it is that we're achieving here today. Before he was even a PS, discussions that we had. And I think everything now, water being under the bridge, we are where we are, implementing concepts and ideas that we had from time immemorial. And all that we are here, maybe I give a reminder. Cancer today is the third leading cause of death in the country. As we speak right now, we have an average of about 47,000 new cases on an annual basis. The death rate caused by cancer has surpassed from what was 27,000 to now up to 32,000 deaths annually. And cancer does not pick one's tribe. It does not pick one's gender. It does not pick one's age. And more so, cancer does not pick what someone's capacity or capability of what their pocket can be able to give them. Cancer is a scourge that is here, and we are here proudly to be able to save lives of those who need, be there for support to those who need our support as leaders, as government. Previously, we would have a situation where people would have to travel from Mombasa, by the way, from different parts of this country, and they'd have to travel all over the world. India was a preferred destination, South Africa was another preferred destination, and today someone just has to leave their home and be able to get that treatment right here where we are. Previously, and I need to say this as well, if you had cancer, it was as good as two things would happen. You either sell everything that you own, two, people had to be able to do fundraising for you. However, currently, with the SHA package that is there, which is up to 800,000, which includes both the imaging, the scanning, the radiotherapy, the chemotherapy, and Waziri informs me as well right now that in the event that that amount that is due is finished, then we can still be able to consume from the emergency, the shift part of SHA as well. And congratulations have to be given where congratulations are due. I want to once again thank you. And as always, we have plans that we have been discussing with the CS. One of our plans that we want to do, and we have passed this as a master plan for Coast General Hospital, is we intend to be able to build a ward specifically for cancer patients. One of the major challenges that is there is we don't just see patients from Mombasa alone. We see patients from the whole country. Majority are from within the region, but we see patients from the whole country. And for us to be able to put a ward there means that someone does not have to be able to go back and forth just for them to be able to get that treatment. They can be able to do what needs to be done. We are working with the Ministry of Health. The county government of Mombasa is willing to chip in a bit of money, and we're hoping that the Ministry of Health will chip in the bigger part of the money. As we do that as well, there is another ask, Waziri, that I will be requesting from yourself. The ask that we have is that we need to be able to increase the scope in the service level agreement. The service level agreement was for just the equipment alone. It did not include the other components that are there. And if we can be able to get this, it will be a huge win, not just for the people of Mombasa, but Kenyans at large. And by the way, we also see patients from out of Kenya. We're reversing roles right now as Mombasa. We used to see, our patients used to travel from Mombasa to go to other parts. And now we are seeing a situation where people are coming from other parts of the world to be able to visit Mombasa. We are also on an expansion plan of the hospital. We've already advertised for expanding the hospital. We are hoping, and that is using our own resources. We are hoping to be able to increase the number of wards that are going to be at the hospital. We're planning to change and renovate every single ward that is there, including the beddings and the beds and everything. Increase the number of theaters as well that will be there. So we will be asking from you as well extra equipment that we can be able to use. The Coast General Hospital as well, with the support of the executive, have been on an expansion spree, which means basically that we need to be able to hire more people. And we have done that. We have already hired new people in this quarter alone. And as we speak right now, there's already other adverts that have come out in the papers for us to have more and more personnel. Waziri, there's one thing, and I think this is important, because what it is that we want to make Coast General to be is not a hospital of necessity, but a hospital of choice. Maybe let me rephrase that. We want someone to be able to say they are proud to walk into Coast General Hospital, not because they have no other option, but because this is the preferred option for them to be able to do. And what that means is we have to work hand in hand, from the doctors to the nurses, to each and every one. I have been meeting the community health promoters, listening to the concerns from grassroots level, working with the community health promoters on how we can be able to ensure that we start testing of people from various forms of cancer, from household levels, from village level as well. But the plan that we have for Mombasa is that our hospitals, I repeat again, maybe allow me to say this in Swahili for the avoidance of doubt. Mpango ambao kwamba tuko nao ni kuifanya hospitali ambazo kwamba ni za kaunti ya Mombasa, ikianza na hospitali ya Coast General. Isiwe mtu hana budi ndo anakwenda hospitali ya Coast General, lakini mtu achague kwenda Coast General kwa sababu ilikuwa ni chaguo lake, licha ya kuwa na uwezo wa kwenda katika hospitali zozote nyingine. Na haya yote tunaoyafanya, hakuna maybe say this in English for the interest of the guests as well. There is no other entity that has invested in health, from personnel to equipment to hardware to buildings. There is no other that has been able to invest a larger amount than the county government of Mombasa. We're on a multi-billion expansion plan, but none of this will be worthy. And Waziri, a time will come, I know, that those who will be naysayers and will not want some of the we want to do. And we are going to be able to, we have to change. We have to change. We cannot be able to have huge investments, then people only come here because they have no other alternative or no other choice. People need to be able to choose Coast General because it is where they prefer to be able to go. I think with those very many words, I want to once again welcome you. And again, with those very many words, also to tell all the other Manu fans like Waziri Duale, you still have hope next season. Thank you very much and be blessed. Asanteni sana.
Thank you, Excellency Governor. Now it's my pleasure to welcome Honorable Aden Duale, who is the Cabinet Secretary. Please let's clap for him as he comes. Thank you so much, sir. Welcome.
Yes. The Director General of the International Atomic Energy, our guest and friend, Raphael, who is today our guest of honor, feel at home, the Governor of Mombasa, a very progressive governor, particularly on health. The people of Mombasa, you're very lucky to have a progressive leader on the health issue, and that's why he's the chair of the Health Committee of the Council of Governors. Our Principal Secretary present, CEOs, the CEO of Coast General Hospital, the CEO of this Regional Cancer Center. Ladies and gentlemen, good afternoon. Today is a very proud and historic moment for our country. It's with great honor that I stand before you today as we gather here, not just to commission a facility, but to celebrate progress and to celebrate partnership and the promise of a healthier future for all the people of Kenya. It also gives me a great honor to warmly welcome our distinguished guest of honor, the Director General of IAEA, Brother Raphael Grossi. It's a good day for me because even last night at the airport I welcomed the UN Secretary General. And this morning I have you here. So I have been with the UN family since last night, 11 p.m. So it's good to have you here. And I told the SG that I'm coming to Mombasa. He's launching one of the biggest UN complex in Nairobi. I think Nairobi now will have the third largest UN conference facility after New York and Geneva. So your presence here today is a testament of your personal commitment and unwavering dedication to the IEA in improving lives through science, innovation, and global solidarity. Cancer remains a major public health challenge globally. In Kenya, it's among the leading causes of morbidity and mortality, placing a heavy burden on our individual families and communities, and above all, our health system. For many years, access to radiotherapy services has been limited and has been centralized. with many patients forced to travel long distance, often to Nairobi to receive treatment. This has resulted in long waiting times, as well as substantial financial and emotional strain. These barriers have resulted in delays in accessing care, increased treatment costs, and tragically poor health outcomes. But today we stand at a turning point. We begin to change that narrative. The commissioning of the Mombasa Radiotherapy Center marks a bold step towards equity in cancer care. It represents our commitment as a government to ensure that no Kenyan is denied life-saving treatment because of where they live. So this milestone could not have been possible without a very strong and visionary partnership we have with you. And today we must take a moment to truly recognize and appreciate one such key partner, the International Atomic Energy Agency. Under your exemplary leadership, Your Excellency Raphael, the IEA has transformed what was once a distant aspiration in the tangible reality of Kenya. Through your leadership, the IEA has gone beyond its traditional role of becoming a hope for cancer patients, not only in Kenya, but across the developing world. You have supported us in expanding radiotherapy infrastructure, bringing treatment closer to the people. The IAEA has supported the procurement of modern radiotherapy equipment, including the linear accelerating machine for such centers like Nakuru and Mombasa. These machines are critical because about 50% of our cancer patients require radiotherapy as part of their treatment. As a result, Kenya is moving from a highly centralized system, mainly based in Nairobi, toward a regional cancer treatment hubs. As the PS said, we are now opening up the country. We are opening soon at Jaramogi. We are opening one in Kisii, building one in Nyeri, in Meru, and in all our referral hospitals across the country. You have supported cancer diagnosis. IEA support goes beyond machines. It has strengthened the entire cancer ecosystem, from providing the diagnostic imaging equipment to nuclear medicine support and the treatment planning system. This extends to supporting national cancer planning, policy development, and the quality assurance framework. And in order to do all this, that again will enhance our radiation safety and regulatory system. So you have invested in training of our healthcare workers, building a skilled and confident oncology workforce that we have seen today. I think the testimony of our two doctors from these two centers is a proof. So the IEA invests heavily in training and skill development. Kenyan professionals have benefited from the fellowship and the specialized training. Training programs cover the safe handling of radiation and the quality assurance, as well as site expert mission, where IEA deploys international experts to provide hands-on in-country training. And these engagements have resulted in skills transfer, improved quality and safety of cancer care. It has reduced reliance on external expertise and the development of a sustainable oncology workforce. You have also strengthened our regulatory and safety systems, ensuring that these technologies are used responsibly and safely. The partnership between the International Atomic Energy and the government of Kenya extends beyond the health sector. It goes into infrastructure, it goes into standards, and it has its footprint in the energy, working through key national institutions such as the Kenya Nuclear Regulatory Authority, the Kenya Bureau of Standards, and the Nuclear Power and Energy Agency. Kenya receives a lot of technical support in developing regulatory framework for radiation and nuclear safety, capacity building, and quality assurance. So Kenya also receives support in insight selection, visibility studies, and environmental assessment. These are partnerships that is not only technical, but it is transformational. This has enabled us as a country a very structured and international compliant development for the Kenya nuclear program. As a government, we are fully committed, DG, to strengthening cancer prevention, screening, and early diagnosis. We are expanding treatment services across all our regions in our country. We are investing in our healthcare workforce, and we are integrating cancer care within our universal health coverage agenda. And I'm sure our community health promoters, muko area leo? I'm sure Governor Sharif Nasir has paid his bit, I pay my bit. Am I right? Sindo hiyo? And come July 1st, you will have a full social health insurance fund, comprehensive. We have agreed with the Council of Governors that because you are the frontline healthcare workers, you do a very great work, both levels of government, we're going to provide the specialized bit of the Social Health Insurance Fund, comprehensive cover. Myself and the PS, we have already put it in the budget. And we expect Governor Sharif Nasir to put in the budget. Secondly, for our UHC staff, you know that you send me a lot of messages. So I have an opportunity to answer you so that you don't send me messages when I'm watching Man U or when I'm in the mosque. We have extended your contract up to 30th of June. And the money is available with the PS Oluga. And the chair of health committee will tell you that on the 1st of July, the whole payroll and your permanent and pensionable will be taken over by our county governments. That is for our UHC staff. DG, you know, in Kenya, we have a very good Bill of Rights. So citizens and staff, they engage leaders every night. So I had to make those two items outside the cancer story we're doing today, so that our healthcare workers and our community health promoters know that the Minister of Health and the Chair of Health Committee were in Mombasa today. We recognize that infrastructure alone is not enough. It must be matched with skilled personnel, very strong systems, and sustained partnership. And in all these areas, IAEA has stood firmly with us. To the people of Mombasa and the wider coastal region, this facility belongs to you. It represents dignity, access, and hope. We urge you to seek early screening now available closer to your homes. In closing, allow me once again to express, on behalf of the government of Kenya and the people of Kenya, our deepest gratitude to Rafael Grossi and the International Atomic Energy Agency. Your work is saving lives, your partnership is strengthening nations, and your leadership is shaping a future where advanced medical care is not only a privilege, but a right. Together we are proving that through collaboration, commitment, and compassion, we can overcome even the greatest health challenge of our times. It's now my distinct honor to invite the Director General of the International Atomic Energy Agency to make his remarks and officially launch the LINIAC machine that we got at the courtesy of him. Thank you, brother.
Good afternoon, everybody. Good afternoon. Wow, this is a really good day. This is a good day. It's a good day for Kenya. It's a good day for Mombasa. I've traveled this night from Vienna. You come here, the fatigue goes away. You sense this energy, this sense of community from the musicians and the dancers to the healthcare professionals that are here, the governor, of course, CS, everybody here, Professor Shaukat. I mean, so many friends that I see here. And above and beyond, the speeches and official things we say, it's here where one senses the sense of public office. Because what is in it for being governor or for being the cabinet or for being the parliament and the regional assembly if it is not to change and improve the lives of everybody? And this is the sense of what we are trying to do here. We had this idea a few years ago, together with Shaukat in Vienna, looking at the statistics and seeing that cancer continues to be a big problem. And you heard the statistics. The governor was reminding us of this. And when you listen to these figures, I think we can all agree that there is no room for complacency here. We are still in trouble. When we see so many people suffering from cancer and such a high level of mortality, we feel that we are not even halfway through to what we should be doing. But what we see here gives us hope, like this Race of Hope program that we have launched. So I'm very happy that we have this LANAC here, Nakuru, and I promise I will visit. We cannot do everything, but I'm very happy to see the Nakuru family here. So thank you very much for that. I hope you show me around when I come, and in other places, And I'm grateful to hear this idea of helping others. The idea of Race of Hope is that this is a chain of solidarity. We are now helping people. You were reminding us that you had to go to India, you had to go to South Africa. Now people can have treatment at home. So this is a real change from what was happening before. But this, is a chain of solidarity that binds us all so that we can start helping others. There are brothers and sisters. I was, just a few months ago, I was in Malawi. I was in Liberia. I was in other countries here in the great continent of Africa where they have a fraction of what you have. We have to help everybody. It is not possible that this continues and that people continue to die here from cancers that no one dies from where I live in Austria. This is a scandal, and it has to end. And doing this, having this program together, doing it in this way, I think we are really moving. Not only through the equipment, of course, we all want the equipment, and there is more coming. I know that there is a need for more Linux. There is a need. There are mammography machines in the way, I can tell you. This is very, very important in rural communities for ladies that do not even know sometimes that they are affected from simple cancers that could be treated, and they could be with their families instead of having a sad destiny. So it's an obligation. It's an obligation we all have, and I simply want to say thank you. Thank you for showing me that this effort and that these resources that we are putting at your disposal are being used in this way, in this very effective way. You are an example. You have to be proud of what you are doing here in Mombasa and in Kenya for the rest of the continent and for the rest of the world. So I want to simply say thank you. It is so nice to see. This is my third visit to Kenya, so I see that I feel here with my family. It is good to see that we have the Secretary General of the United Nations, we have the IEA, everybody's coming to Kenya, and for a reason. So you have us, not only for winning marathons, you are incredible, but also for doing something more that is related to that resilience, to get to the end and to do it right. I thank you very much. Thank you.
Thank you. A round of applause for the DG, tafadhali. Thank you very much, Bwana DG, and thank you for your speech. I'd like to just ask us to sit just for a while. Normally, we would allow, after the chief guest speaks, we allow kikao kinaisha, but I have been told that there are gifts to be given out. So I'll kindly ask the chair of the National Cancer Institute of Kenya and also the CEO to please come and assist in the gifting. The ladies bearing the gifts, kindly just move on the side so that the CEO and the chair can be able to present the gifts to the guests that will be here. Karibu tafadhali. Stage. Be able to present from Hapa. Do you need the microphone or should I just go ahead? Okay. So then I would like at this point to call upon Professor Shaukat to be the first one to receive a gift. Tafadhali. Professor? Enda upokee gift tafadhali. Hayo ndio makofi mnapigia kijana wenu jameni. After Professor Shaukat, tafadhali Bwana PS Oluga, tafadhali also proceed to receive your gift, tafadhali. Mpigieni daktari makofi. Daktari unauliza kama ni pesa, tulia utaangalia utaona. Usiogope. I'd like at this point to call my boss and the governor, His Excellency Abdul Samad Sharif Nasir, to please also receive the gift. Wapi kelele ya governor? CHPs hoye! Asante sana. Bwana CS, kindly also proceed to receive the gift. Bwana CS, tafadhali, kindly just proceed to receive the gift as well. Sawa sawa. Bwana CS anasema mbona tutam iko hapa peke yake? Hakuna tutam hapa. Wapi tutam ya CS? Wapi tutam ya Rais Ruto? Asante. Bwana CS, tunakuomba kindly stay on stage. You'll assist us to give the DG. DG, kindly take the stage to receive the gift. Na DJ tunamwambiaje? Mapokezo hapo zawadi. Beautiful gifts. Asante sana. Over to you. We are requesting all the guests, Your Excellency, kindly come up the stage. The PSS, kindly, Daktari, Professor, please join us. The CEO, I'd like to request that you come up so that we can have gender balance on the photo. Kindly take the stage. We need to neutralize a bit of the testosterone. Fatma, tafadhali. Dr. Fatma naomba. Pole pole to take your time. Kindly just await Fatma to be able to take the stage as well. Hiyo picha imeweza ama haijaweza? Wapi makofi ya mashini ya leo? Asanteni sana. I'd like to request the CEO to please give us a quick vote of thanks. Kindly just switch on the microphone and then we'll proceed. Thank you.
Wakati mnasalimu CS na wageni wetu, we have come to the close of this very, very important meeting this afternoon. And I want to believe that we have all seen the fruits of proper leadership at the Ministry of Health and at the county government with all the partnership that exists. Allow me, our chief guest and our CS, to thank everybody who has today participated in this event. CS, in the morning, we had a workshop with our cancer survivors and our community health promoters before you came here. We have delivered a training on how to prevent cancer and how to treat cancer. Number two, I would want to appreciate the committee that put together this activity. This was a multi-stakeholder planned event, and we are really grateful. Thank you, our DG, for accepting to come. Thank you, our CS, for the leadership, our PSS who are here, our governor, always happy to support our activities, the leadership at the county, the leadership at the national government. This meeting today has come to a close, but work continues to make sure cancer is no longer a threat to anybody in this country. With those few and many remarks, I'm kindly requesting that we stand for the national anthem as we bring this to a close. Thank you very much.